No, I've not been involved in any discussions of personnel change. Thank you for the question. I mean, I'll be honest with you. We've been criticized for a year about one thing or another, right? And we understand that the community gets frustrated with us over one issue or another. But what I can assure you is that everyone in the health department, everyone in the mayor's administration is working really hard to do the best that we can do for our citizens. And that the criticism comes with it. You know, feedback of all kinds comes with that. We understand that. But our effort is squarely to try to meet the needs of the community and to get the vaccine out, to protect the community in all the different ways that we can, to slow the spread of the virus, to preserve life. You know, that's our mission, that's our vision, that's our values of what we're trying to do. And but we understand we're imperfect. We don't get it right 100% of the time, every time. But the effort is genuinely, and the intent is genuinely to do the best we can every day.
How surprised are you at how good the numbers have been recently on cases?
I have to be very honest with you. I'm very happy with that and a little bit surprised. And we have, I mean, yesterday I was in conversation with a couple of state epidemiologists and we were discussing this, so looking across the Southeast. And when we look at the numbers in the Mid-South, right here and locally, and our case rates per 100,000 are now about 11. And every county in the Mid-South is also seeing improvements. And right now, the lowest case rates are over in Crittenden County in eastern Arkansas. So the numbers are coming down a lot faster than we really expected them to. And we do take a little bit of a grain of salt with this right now, because the recent numbers are probably artificially depressed by the winter storm. And that did reduce the number of people going out to be tested and diagnosed, which lowers your case numbers, right? So we're not going to be surprised at all if this week there's a bounce back. As the testing sites are back fully operational, we may see an increase this week in numbers. But in general, very pleased that the numbers are improving. In general, the community is benefiting from that, because with Health Directive 18, as you saw, we were able to loosen some more restrictions on things like our retail restaurant businesses. Then, unfortunately, we got blindsided or hit hard by the water pressure problem. And so then a lot of places can't operate, but it's not because of COVID restrictions, it's because the water pressure is too low. So, you know, we're continuing to address that, or at least MLGW is continuing to address that. But as far as progress, we're grateful for the progress, and we're not out of the woods yet by any means, but we are getting closer and closer every day to seeing a light at the end of the tunnel.